public opinion research, those who got the first dose is very likely to get the second dose, but people must not forget second dose is very important, especially given the Delta variant, and that second dose confers very significant increase in protection. And so I think ongoing communication on the importance. Operationally, provinces may have different means in terms of reminding people to get their appointments, and I think again, many different innovative approaches are being sought. We are funding a lot of community-based organizations, trusted voices, community leaders to ensure that the population that trusts them are getting the right messages about the importance of that second dose. But don't forget to keep increasing the first dose as well.
Thank you. Merci. Operator, our next question, please. Prochaine question.
The next question, la prochaine question est de Annie Bergeron-Oliver from CTV National News. Please go ahead. Your line is open.
Hi, thank you very much for taking my question. This is for either Dr. Tam or Dr. New. Both of you have warned the modeling shows that there is a potential for a fourth wave fueled by the Delta variant in the fall, which is only weeks away. Is it prudent to be opening the border now, especially as some evidence in the U.S. suggests that fully vaccinated individuals may transmit the Delta variant just as easily as non-vaccinated individuals?
Well, I think we're watching the situation very carefully. I think the domestic situation, if we're going to get a fourth wave based on our modeling, including modeling importations, is likely to be driven by domestic transmission events rather than importation cases. But we'll continue to monitor, but also project and model that situation. So right now we're taking a precautionary and phased approach to the border reopening. So only fully vaccinated U.S. citizens and their permanent residents will be allowed to come in without quarantining, but they still have to take a test before they leave, and they still will be tested after they arrive for the foreseeable future. We will look at the test positivity rate in order to adjust our stance. So far, you remember we had a lifting of measures for those already able to come into Canada in terms of the quarantine requirement for the fully vaccinated. The volume of travelers have increased, but the positivity rate has not. So at the land border, for example, most of the travelers, of course, from the United States, and the test positivity rate has remained very low. And that is a really good indicator for us to track. If we see any significant concerns, of course, we can adjust our border stance accordingly. For now, I think all the indicators are still pointing in the right direction for that next phase in terms of a border approach.
Yeah, and as Dr. New, I maybe just add a couple of points to what Dr. Tam has already said with a very sort of comprehensive answer. Obviously, looking at the travelers coming in, we're taking all sort of the reasonable steps in terms of risk management. You know, only fully vaccinated travelers coming in. They have to get a test before they even come to Canada, get a test upon arrival, and so on. But the other important part is also, again, stressing a point that the higher the vaccine coverage here in Canada, the more protected we are as a population, the more resilient we would be for any possible, sort of importation of cases. And certainly everyone's concerned about the Delta variant, but what's driving, or what's certainly going to be, I think, a major issue is our domestic transmission, as Dr. Tam's pointed out. Delta variant's already here, so I think we need to also be mindful and really track and take care of our own house, and of course manage what we do with travelers coming to Canada as well. Thanks.
Okay, great. Thank you for those thorough answers. And on a sort of change of subject, the Prime Minister just said he's looking at mandating vaccines for people employed by the federal government as well as people in federally regulated industries. Do you believe this is feasible, and what impact could this change have?
Well, I think this is under discussion. I think the federal government, being a significant workforce, is looking at how we best protect our workforce as well as those around us. So I think everything is being reviewed and examined right now. So I can't sort of preempt what the outcome of all of those discussions might be. But again, to emphasize that it's really important for workplaces to, if we're going to have people come back to work, that everyone should get the vaccine.
It's Dr. New. I think that I would add the additional points. It's interesting. If you look at it from a behavioral science perspective, obviously the overall goal and objective, as we've always stated, is to vaccinate as many eligible Canadians as quickly as possible with obviously the full sort of 2-dose schedule. So having said that, if you look at sort of the range of tools in the toolbox, what could be used to get people vaccinated, you have what I would call a range of measures from what I would say the least coercive to the most coercive. Obviously, at one end of the scale, you've got good information, getting the information out so that people can make an informed decision. And based on sort of their good understanding and understanding the risks and benefits, go forward voluntarily for vaccination. Then if you move along, along that scale, as we've seen that maybe there are other things that might motivate and drive people to get vaccinated. For example, could or should there be certain privileges for those who are vaccinated versus those who choose to remain unvaccinated? And you can see that, playing out in some of the various provinces and territories. So that's sort of another sort of tool in the toolbox. And of course, at the part end of the scale is, of course, the regulatory or sort of legislative approach. But that's something certainly that needs to be looked at careful a bit. I think to add to what Dr. Tam said, I think, we're looking at all of the options, but the ultimate goal, of course, is to just get as many Canadians vaccinated as rapidly as possible. Thanks.
Thank you. Merci. Opérateur, la prochaine question, s'il vous plaît. Next question, please.
The next question, la prochaine question est de Dylan Robertson from the Winnipeg Free Press. Please go ahead. La parole est à vous.
Hi, Dr. Tam. The Manitoba government is making masking discretionary as of Saturday, with 80% of the population fully vaccinated and 72% having a first dose. With the Delta variant circulating, I'm wondering if that's enough immunity to avoid a fourth wave in our health system, and if you're advising provinces to open slower.
Well, I think, first of all, again, congratulations to the provinces for achieving some of the highest vaccination rates in the world, and just keep going, I think, is the key message here. Any additional layers of personal protection, I think, can help reduce the risk even further of a fourth wave. I think as the federal government, we provided some guidance on that front. It is very difficult, I think, in some public settings to figure out who's vaccinated, who is not vaccinated, and that the prudent thing to do is just add other personal protective measures, such as masking. And so I think the Manitoba government is moving away from mandatory, but I think everyone should do a personal risk assessment. That's what we said, is that, the higher risk places, the enclosed, crowded, poorly ventilated environments, and a mask could have that added layer of protection. So even vaccinated people, if you look at our guidance, if you knew who you were interacting with and that they're all vaccinated and it's in a small group, great, go ahead, remove your mask if everyone's comfortable. But if you start looking at bigger gatherings and in enclosed environments, that even for the vaccinated people, please consider whether there's safety measures in place, and wear a mask as an additional protection. I think for chief medical officers, they're all thinking, well, people have learned a set of personal habits and behaviors to reduce the risk from not just COVID-19, but other respiratory infections, and that these kind of good habits should continue, including obviously staying home if you're sick. I would say adding another layer of protection, such as wearing a mask, could help. Every bit kind of helps and increase your chances of being able to open essential places like schools and other areas as well. So I think one would encourage this kind of adoption of individual personal protective measures.
Thank you, Dr. Tam. And also regarding the Delta variant, the Manitoba government still has no timeline for when it will publish modeling on the impact of Delta. I'm wondering if you can confirm if that is helping Manitoba either with the modeling for Delta or screening tests for Delta. And do you think this modeling should have been made public already?
We actually provide our modeling data to the provinces on an ongoing basis, and we discuss it at the Special Advisory Committee. So it's all shared. So of course, individual jurisdictions can add the different kinds of modeling or additional data points, but those kind of modeling studies have already been provided, not just for the national level, but also the provincial breakdowns. Models, of course, they're different models, and they're used for different purposes in terms of looking at scenarios going forwards. But again, Manitoba's done really well, and I think can just keep going to keep their transmissions low and prevent their health services from getting overwhelmed. I think our modeling, of course, that was presented, not just focus on case surges, but keeping the health system intact and not overwhelmed depends on, right now, one of the key things is getting younger populations vaccinated to up to 80% or above. That's still the same for Manitoba as everybody else. And the testing and continuing testing and contact tracing is also important. And with both of those measures, the modeling shows that even with Delta variant, you can keep below that sort of red line of healthcare capacity being overwhelmed. Even at a provincial level, you may have to look at local situations as well. The health capacity is not the same everywhere. So there'll be further analysis, I'm sure, that's being done at the even more granular level than the provincial itself.
Thank you. Merci. Operator, next question, please. Prochaine question, s'il vous plaît.
The next question, la prochaine question est de Clara Descourningues de la Presse canadienne. Please go ahead, la parole est à vous.
Bonjour. Donc, je voulais savoir, avec la majorité des
I have a
Canadiens
question.
qui sont...
With most Canadians being vaccinated and the fact that they will continue to be vaccinated, if there is a fourth wave, what will be the measures? And will there be different measures for Canadians who are vaccinated versus Canadians who are not vaccinated? Answer. If I understood correctly, there might be a fourth wave. It's an important issue that we are continuing to discuss with our partners of the different provinces and territories, including Quebec. The goal here, if we're talking about public health, is to continue to encourage all eligible people to get vaccinated. It's very important to have a good level of protection in the population. We're seeing the impact of vaccination. We're seeing some good results so far. The rates of hospitalizations and deaths are much lower than they were before. But we'll need to continue to monitor what's happening. We have to look at indicators, for example, the infection rate, the hospitalization rate. These are things that we will continue to examine nationally and in the provinces and territories. And it's up to the provinces and also at the local level to monitor public health measures depending on the local factors. Follow-up question. What would be the difference with the fourth wave with more people being vaccinated than in the first and second wave where hardly anyone was vaccinated? Answer. the cases are increasing in a lot of regions, and we're not surprised because the Delta variant is highly transmissible. And more than 80 to 95% of our cases in hospitals are with people who are not vaccinated. So if there is a fourth wave, there might be a lot of infections, but with people who are vaccinated, it is possible to be infected, but the impacts will not be as significant for people who are vaccinated compared to people who are not vaccinated. So if there's to be a fourth wave, it will be a fourth wave that will especially impact people who are not vaccinated. And so to manage a fourth wave, we'll have to encourage everyone to get vaccinated, because in the fall, we're going to want to have indoor meetings, we're going to meet in schools and in the workplace, and that will be true in the winter as well. So it will be important to plan for a fourth wave and to protect ourselves against a fourth wave before winter. Thank you.
La prochaine question, s'il vous plaît. Next question, please.
Thank you. The next question, la prochaine question est de Abigail Biman from Global News. Please go ahead. Your line is open.
Thanks for taking my question. I'm wondering if there's been any progress on the question of Canadians who received mixed doses and may be barred from travel or certain events. Do you recommend that provinces start administering a third shot as Quebec has done?
Certainly, I think from our federal level and our perspective is that we are having ongoing discussions, obviously, with other countries and with any of our international partners, and collecting, of course, the evidence on the immunogenicity, safety, and also the vaccine effectiveness of that mixed schedule. So I think that is the focus of our work right now. I think, obviously, the question of additional doses and boosters are under active review and discussion right now with our expert advisory committees. I think what I would recommend at this point is, of course, plan your travel way ahead of time and look at what each country's requirements are. We don't really know the exact impacts of adding another dose to the existing schedule. So I think people need to be aware of that if that is a route that they want to take in terms of additional dosages. So I think we will, of course, do our utmost in providing that perspective to other countries. But I think we and a few other countries in a very privileged position, and others are not. So I think you gotta still keep watching for individual countries' requirements in terms of vaccinations. It is going to be a bit confusing and complicated in the next months ahead, but the international travel approaches will probably settle out, after a little while, especially once more countries become vaccinated.
It's Dr. New. I guess the additional point I would stress, and Dr. Tam's already mentioned, is that certainly for any individual, but even at a population level, the number of doses that an individual should receive of a vaccine, or even a mixed dose schedule, it should be based on the science and the evidence, safety, vaccine effectiveness, and so on. And I think it should be based on the science and not sort of, I think, on convenience factors, or based on sort of policy, be it other countries and what they are accepting or not accepting. We're continuing to work with these other countries and internationally as well with other partners to develop a more coherent approach. Hopefully internationally that does allow, I think, travel between countries based on acceptance of certain vaccines and schedules. But at this point, I think it's important to stress that vaccines and the number of doses should be that should be given to any individual should be based on the science and not really on other factors such as that. Thank you.
Thank you. And I'm also wondering for both doctors to weigh in with a potential federal election coming soon. Can you share your views on weighing the risks of voting by mail versus voting in person? And have either of you decided whether you would vote by mail or vote in person in any potential election in the near future?
Maybe I'll start. I think that safety protocols have been put in place for different elections throughout Canada during the last month. So I think that can continue be provided. I think voting places where people vote can put together measures that minimize risks. The other thing is that, of course, so many of us are now fully vaccinated, which adds even more protection. So that I think that there's definitely ways to vote safely. And those kinds of guidance is what we would provide to Election Canada. That's the sort of public health guidance. And also link them to our provincial counterparts to make sure that they have to plan at the local level, depending on the local epidemiology and what their requirements might be as well. But voting can be done safely. Certainly, if there's a mail-in option, people can take advantage of that. You can look at your own level of risks and whether, and the other thing is accessibility, whether someone is able to access voting venues is important as well. So I think it's great to have an option, but in-person voting can be done safely.
Thank you. Merci. Operator, next question, please. Prochaine question, s'il vous plaît.
The next question, la prochaine question est de Juliane Lapointe de Radio-Canada. Please go ahead. La parole est à vous.
Question from Radio-Canada. Hello. I would like for you to talk about rumors of an election. Do you think that that's responsible when we're talking about the possibility of a fourth wave? Are we worried about transmissibility when candidates travel from one location to another? And what would this mean for mail voting, for example? Answer. It's a little similar to the previous question, but with all of the public health measures that are in place, it will be important to follow local health measures and provincial health measures. Regardless of who you are, if you're traveling between provinces, it's important to examine what the requirements are and what needs to be done. Even at the individual level, I think that everybody knows by now how to protect themselves and how to protect others. We are encouraging everyone again to get their 2 doses, to have a complete vaccination. And beyond that, it is important to follow all of the local public health measures and to continue to use all personal protective measures. And beyond that, as Dr. Tam stated in her response to the previous question, if there's to be an election, it will be important for everyone to use their right to vote. and we have more means now to vote. And it will be an individual choice. But for me, with all the public measures that are in place, it shouldn't be an issue if we want to vote in person or use other means to vote. But the most important thing, if there is to be an election, will be to vote. Follow up. Prime Minister Trudeau said that vaccination could be mandatory for public servants. Do you think this is necessary in order to accelerate vaccination? Is it the only solution, or might it be possible to continue to encourage people to go on their own? Answer. I think I may have responded already a little bit in English, but I'll repeat it in French. It's important to vaccinate as many eligible Canadians as quickly as possible. We want a vaccine coverage of over 80%. Why not try to reach 90% with 2 doses? And we have different tools to reach our goals. We have, for example, the possibility to give credible information to people, data that we can give to Canadians so that they are well informed and can take decisions regarding getting vaccinated. We know the benefits of the vaccine against COVID-19, and there are other means as well at our disposal. For example, in Quebec, there are means to encourage people to get vaccinated. It can be a tool to give privileges to people who can show their proof of vaccination. They might have access to a larger range of activities. And we could also regulate vaccination. But that's more complex because there are many factors at play. Because there's the labor code and other such issues, and we would have to work with unions for that. And if we were to consider such a tool, I think it would be very important for me and also for workers in the field, for example, in health. It will be important to get vaccinated if we're working with patients or vulnerable people, people with cancer, or with a weakened immune system. So that might be a group of workers and for which we could examine the pros and the cons of mandating vaccination. Thank you.
Prochaine question, s'il vous plaît. Next question, please.
Thank you. The next question, la prochaine question est de Chris Nardi from the National Post. Please go ahead. Your line is open.
Hi, good afternoon. I was wondering, with Mr. Trudeau's announcement earlier that he'd mandated the clerk to look into the possibility of requiring federal public servants and federally regulated employees to get vaccinated, is that a measure that either of you have either suggested, recommended, or even support? Is it something you support? And is it something that eventually you'd like to see possibly extended to the entirety of the population if it is determined that it is possible to do?
Yes, this is Teresa Tam. So it is the discussion is led. Certainly, the clerk is very much involved, and the Treasury Board as well. And it mainly involves those looking at occupational health, and every deputy, of course, also has mandates for their own departments. So it's these kind of conversations and discussions and being done at a deputy minister's level. Of course, we can provide public health guidance, but in the end, I think these are occupational and labor type policy decisions, and these are evolving at this time, so I don't think I could comment on that further, except just to say that yes, every option is being examined at how to ensure that our workplace is safe for everyone, but also, as Dr. New has said, looking at who the federal employees are interacting with and whether they're at high risk. Those are some of the considerations during those discussions.
And as a quick follow-up, the Legault government also announced that Quebec would be the first to put in place an official vaccination passport. And the Premier also said that they are seeing what they believe is the beginning of a fourth wave. It's not hypothetical, but they say that it's happening now. The vaccine, we don't have many details on the passport per se and what it'll do, but is that something that you would like to see other provinces start putting in place, basically that allows, rewards essentially fully vaccinated people and allows them to continue living a nearly normal life, as he said? Is that something you'd like to see elsewhere, everywhere, in every province?
Well, I think I gather that was a very recent announcement, and as usual, with other chief medical officers, we like to learn from each other and across Canada. Every jurisdiction is different. They understand the population and what works and what might not work. But I think the key is to see, well, is this a best practice that can be adopted by others? What are the considerations if other jurisdictions are to look at that? Can be shared for sure at the Special Advisory Committee. So we look forward to the contribution and discussions from Quebec. At the same time, of course, there's ongoing discussion from a federal perspective on looking at a vaccination proof for the purpose of international travel. So that is the space that we will work in, but at the same time, that means we are working with provinces on looking at ways of standardization, the sort of data requirements, as well as the credentialing of those vaccine certificates from provinces. So those are very much an active piece of work as well. But from the federal perspective, of course, I actually do think that the precautionary approach that we're taking at the border might actually stimulate people to get vaccinated as well, because of course, if you're fully vaccinated coming across back to Canada, you have to do some testing, but you're exempt from the quarantine requirements. So that, I hope, is a significant incentive as well.
Yeah, and Dr. New, I think we've sort of maybe answered or responded to previous questions which have been similar, but I would say that, as Dr. Tam said, that, the provincial officials obviously know their population best, and really the ultimate public health objective, in all provinces and territories, is to vaccinate as many eligible Canadians as quickly as possible with the 2 doses. So how do you achieve that objective? There's a range of tools in the toolbox. At the one end of the scale, it's really providing credible information, explaining to the population the risks and benefits, and so on and so forth. And if there are, I think, accessibility issues or other maybe logistical barriers, I think the provinces and territories are doing an excellent job. For all those who are, based on the information and the understanding of the science, fully want to get vaccinated. And as we've seen with the polls, I think it's close to 90% of Canadians that have either received 1 dose or intend to take at least their first dose and then go on to get their second dose. So that's very good. but we could do better. And so what I think you're seeing now is that provinces and territories, obviously based on their local context, are also looking at what other tools could be used to encourage and get more people vaccinated. And so the issue of sort of be vaccine passports or other motivating means, we've seen everything from lotteries to maybe giving additional privileges to individuals who show proof of vaccination. If that's what it takes to get someone vaccinated, beyond just giving them the good scientific rationale for getting vaccinated, that's fair enough. And then of course you look at the sort of the far end of the range of tools, the regulatory legal approach with mandatory vaccination. That's also a live issue, and that's also being examined, I think, at all levels of government as well in Canada. Thank you.
Thank you. This will have to be our last question. Operateur, dernière question, s'il vous plaît.
The next question, la prochaine question est de Charlie Pinkerton from iPolitics. Please go ahead. Your line is open.
Yeah, hi, good afternoon, everybody. I asked a few weeks ago, Dr. Tam, what about the UK's reopening, given that it was happening amid sort of soaring cases, but with a largely vaccinated population. You were going to be monitoring, and you sort of explained that you would be, watching it with interest. So I'm wondering now, with Canada, based on the projections of the modeling last week, seeming to be heading in that sort of direction, what you've taken away from what's been going on in the UK and how it can be applied in Canada in a way that allows for perhaps a less restrictive or a better reopening for everyone, as I'm sure they would call it, based on how the last year and a half has gone.
Yeah, no, I think looking at the UK trajectories as a country that has generally been a few weeks ahead of us in the epidemiology continues to be important. So, the cases escalated very quickly, and there's all sorts of hypotheses as to why it sort of dropped so quickly. That is, still undergoing analysis, I'm sure, by many experts. But the lesson learned is that it's really still being fueled. It was fueled by outbreaks mainly in the unvaccinated population. So that could still happen to us, given the still a number of individuals in the millions have not taken advantage of becoming fully vaccinated as yet. But we're doing pretty well. I think we and the UK have some of the highest vaccination rates in the world. What this tells me is that with reopening, we might expect cases to go up. Try and keep those relatively low so that you're not getting these sudden surges that might at least incapacitate some areas of the country. So making sure localized outbreaks can be managed. But the other thing that is too early for us to tell right now is the impact on the severity indicators. The UK is showing that while cases went up a lot, at the same time, the hospitalizations went up, but nowhere close to what they were like in the preceding wave when not so many people were vaccinated. So that is being monitored very carefully in Canada. Given our vaccination rate and that we have some excellent vaccines, I'm hoping to also see that the severity indicators are kept low as well. But it's too early to tell. So far, those indicators are very low and still on the decline. So that's, I think, the ultimate objective is that to keep hospitalization, ICU admissions, and deaths as low as possible.
Okay, thank you. My other question is related to what the WHO is requesting around booster shots, and that countries hold off on doing that until the end of next month to allow other countries to catch up in their vaccination. With what's known and believed right now about booster shots, their necessity or validity, what would be most effective to reaching the end of the pandemic for Canadians in whatever way you define that, would it be prioritizing sending doses to other countries that need them, or would it be keeping them here and potentially administering boosters to those who they might be needed by?
Yeah, I think I may sort of propose that one can do both. It's very important to look at particularly high-risk populations and examine the data pertaining to those subpopulations. So whether they're immunocompromised, that's one of the top groups that are going to be examined in terms of the need for a booster. Some of the earliest vaccinees in long-term care, that's some of the next groups that will be examined. So far, as I said, we haven't seen any specific breakthrough infections in that group as yet, but we'll be monitoring that really closely. It is a live sort of examination of the data, but also expert advice right now. So we haven't moved forwards to make any recommendations in that space as yet, but it is a live discussion. But at the same time, I think I believe there was one announcement yesterday also about donations from Canada to other countries, and that is also very important. And without the rest of the world being vaccinated, it's very difficult for us to, get out of the pandemic. And also, it would have impacts potentially on our precautionary but phased border reopening. So, Canada has in its, I think, range of vaccine options, a lot of capacity. So I think we can definitely do both.
Yeah, it's Dr. New. I would just underline the point that we have enough doses in Canada to offer the full two doses to all eligible Canadians. That's been that's been the reality for at least a week or so. And at the same time, we're already starting to contribute to the global effort in terms of donations. So I think, as Dr. Tam said, we can do both.
Thank you very much. That will conclude today's press conference. Thanks for your participation. Any additional questions can be directed to Media Relations at the Public Health Agency of Canada. La conférence de presse est maintenant terminée. On vous remercie de votre participation. Si vous avez d'autres questions, n'hésitez pas à communiquer avec le Bureau des relations avec les médias à l'Agence de la santé publique du Canada. Merci et bonne journée. Thanks and have a nice day.